Woman, an in-depth exploration of the world of women today with Sandra Elkin.
Good evening and welcome to Woman. Our topic this evening is menstruation and premenstrual tension. My guests are Cynthia Clayton. Cynthia is a practicing pediatrician, and Leah Schaefer. Leah is a psychologist and author of a book called Women and Sex. Welcome to both of you.
Thank you.
What did your mothers tell you about menstruation?
Well, my mother didn't tell me anything at all, nothing at all. There was no information that she gave to me, and whatever I learned about it at all, I gleaned from the girls in school and the kids in the street. And I remember when I came home one day, and apparently I'd had some kind of a mark on my underclothes, and she said to me, "Leah, do you know that you're menstruating?" And I just got so scared, and I blanched, and that was all she ever told me. But then when I calmed down, I was really quite excited, and I felt terrific, and I couldn't wait to go and tell the girls in school, because I felt this really made me just like them, and it was it's really a day I'll never forget. But I don't think any girl ever forgets it, really.
Cynthia, how about you?
Well, my mother and I had gone to the library to get a book, but we had done this about a year or two before I got my period. And I remember really looking forward to it. Some of my friends had already got their period, and I was really pretty excited. But I learned from the book, and I learned mostly from my friends too, reading.
Did either of your fathers give any reaction to this at all?
Well, my father didn't at all. My father never made any comment on this, nor on any other aspect of sexual development. But I did learn something really quite interesting when I did the research for this book that you mentioned. I found something quite interesting, which was a lot of the girls would mention that they had thought of themselves as father favorites, you know, the favorite child of the father. And they would tell that when they were little, they remembered doing a lot of things with their fathers, and that he would take them out on Sundays or weekends, or that he'd let them sit on their laps and so forth and so forth. And then they would invariably say, and then, I don't know, something happened, something changed, and he didn't treat me like that anymore. So I started to be very interested in this whole phenomenon about what this was, and I would ask them at what age did they feel this change took place. And they would invariably say, well, I don't know, maybe 11, 12. And it always turned out to be the period at which, the time in their life, that is, when they would start to get their period. And it was really interesting because the fathers then felt that he shouldn't treat them in the same way that he had treated them when they were little girls, because the father now felt that they were like young women, and that all the feelings that he had felt for his daughter when she was a little child, which was really quite a normal feeling to have, he felt now that he must repress them. And so what he tended to do in a lot of these instances was to push the little girl away. And of course she didn't know what had happened. She didn't know why the change in his attitude towards her. And so she felt, because it wasn't spoken about, he didn't say anything to her invariably, she felt now that there was something wrong with her. My father used to like me, now he doesn't. And what the change was that she was no longer a little girl, she was more like a woman, end quote. And I think in a certain kind of way that this attitude has something to do perhaps with why a lot of women tend to hold to little girl actions and little girl ways, because they have a lot of remembrances of being more acceptable when they were little and dependent, as opposed to when they seemed to their parents to be more grown up.
Of course, it depends on how the father perhaps treats his wife when she's menstruating or having her period.
Mm-hmm.
And the other thing now that girls are having their period so much younger, this is getting to be an important thing. It's not uncommon for a young woman to have her period about 11 and even 10 years of age would be still within the range of normal. And if you take this kind of feeling away, this kind of loving feeling away from a child at age 10, 11, this is going to be quite a problem.
Why is it true that young girls are having their periods at a younger age?
Well, they're not really sure. If you read in the literature, It's quoted that people are growing taller faster, they're gaining their skeletal maturity a little faster, and perhaps the axis, the pituitary and hormonal axis that is working is set off at an earlier age. This hormonal kind of relationship that exists. This hormonal relationship exists all throughout your infancy and early development, but something makes it go at full blast, and no one is really sure yet, but growth hormone and some of the other hormones are supposedly implicated.
So is 11 the average age at the moment?
11 is the average age, and 10 is not unreasonable. We don't consider that too early.
Leah, I want to get back to what you were saying about the
Yes.
father's attitude originally. How should that have been handled, do you feel?
Well, basically, I feel, for instance, that that I think that parents' feelings for their children are very natural feelings to have, and that. But the whole area of parents' acceptance of their sensual feelings towards their children in general is something which parents find themselves unable to accept, generally speaking, because most of the time I find that adults feel that a feeling about something which is unacceptable in the acting out is a feeling that one should deny. That is, if you feel that the action is wrong, then you must deny even having such a feeling, although the feeling would be a very natural one to have. And I think that if the father, for instance, either spoke his anxiety to the girl, or said, you know, I don't know how to be with you, or even just accepted his feelings about her because she's certainly as acceptable a person after her menstrual period as she was before, I think that would give the girl a much better feeling about herself and more self-acceptance. If her parent can truly accept her, then I think it makes it more possible for her to accept herself. I think that the whole area of menstruation, I don't know if this is really getting off the subject exactly, but I think the whole area of menstruation is an area which seems to have so much taboo around it, more so than almost any natural, biological, sexual area. And I've been wondering really why it is.
Maybe Cynthia can get into that a little bit.
Yeah.
Because she deals with young people all the time. And
well, it's true really of older, the way older people react to it too. And for instance, I think one of the things is that I think that the fact that we associate blood with it, for one thing. I think blood flowing, now menstruation is not, really a blood flow, but it's partially that, more so than I thought. But even so, I think there's something about blood flowing which makes something very, very mysterious and frightening to a lot of people. And I think that it seems so mysterious. I read something someplace in which they talked about the fact that men in a certain tribe who would notice that the women would have, in their periods, of course, they would see a monthly menstrual flow, and they always associated blood flowing with a disease. So they tended to think of the women as diseased, and yet nothing seemed to happen to them from month to month. So the women seemed to be possessed by some kind of, magic or some kind of something that they didn't understand, which simply added to all the mysteriousness of it. And that which is mysterious is very frightening.
Do you think we tend to keep this away from men for the most part?
Well, I do think that we do. I think that women tend not to even talk with each other about it very much, and I certainly think that women don't talk to men about it at all. And I had an interesting thing that happened one night in one of my therapy groups when someone brought up, one girl talked about what her problem was, and she was saying that she was feeling really rotten, and she said that it interfered with her relations with her boyfriend because she felt that when she has her period that he couldn't possibly like her or want to be near her or have anything to do with her. And she said, and no matter how many times she learns that it doesn't bother some men, she says she can never believe it. So I went around the room and I asked the men to tell her how they really felt about it. So some men, two of the men said that it didn't bother them at all. One of the men said that he sort of liked it because he didn't then have to worry about pregnancy, either of them being responsible about it. And one man, in fact, the man who was married the longest, said that it really bothered him. He said, in fact, it sort of disgusted him. So then I asked the women how they felt about it, and would the women share their experiences with each other and with the men. Well, it was the most interesting thing because it turned out that none of the men knew anything at all about it, nor had the women ever discussed it with the men, nor had the women ever, in fact, discussed it with other men, with other women. So this one man, the longest married man in the group, in fact, came in the next week and he said that it was the most thrilling group session that he had ever participated in. And he said that he felt that it was so wonderful for him. He said he'd never discussed it with his wife until then, and he went home and discussed it with her, which he had never talked about at all in 13 years of marriage. And he said, I asked him what he thought was so wonderful about it for him, and he said that he felt it was so terrific because he felt that he had been let in on a secret, that he had been given the privilege of being let in on a secret. And I thought that that was really a, kind of a wonderful statement on his part. But I also realized something that I think you were implying in your question, which is that women do tend to hold this information back from men for whatever the reason. I don't know whether it's because they feel ashamed or because they would like to keep this a secret or something unto themselves. I really don't know why. I guess it's different for different
What about
women.
the young girls that you deal with?
Well,
Cynthia?
the cultural taboos of the mother are visited on the daughters. There's no question about that. There have been some studies performed in this country and other countries to show that those girls that have a lot of problems with their period or before their period, their mothers also had a lot of problem with their period and before their period. And this has been very well documented. It depends on your religious views. It depends on how your family lives. But really, it does depend on how your mother feels about her period. Perhaps how you were going to feel
cultural
about
then. It's
yours.
not necessarily physiological.
I think to a great extent, a lot of the symptoms that are considered uncomfortable and associated both before the period and with the period are based on cultural attitudes, especially right within the family.
There's also a lot of feelings that are physical feelings. That is, premenstrually, you can have a lot of tension and a lot of sort of low, tired, or depressed feelings, which would be very normal, really, for the kind of hormone change that one goes through near that time. But also, since these kind of gland changes has to affect your brain, and very often it can make your outlook seem different just because you're going through a physiological change, although temporary.
There are people, though, who believe that premenstrual tension doesn't exist.
I tend to agree with that attitude. Although
That it doesn't exist?
Well, for some people, yes, it does exist to a certain extent. You have to differentiate between the truly physiologic symptoms and perhaps the psychological symptoms.
Well, how do you know
yeah,
that?
that's
How can
the thing.
you differentiate?
Sometimes you can't differentiate, and then you see most of the time glandular changes take on the kind of symptoms that appear to be emotional symptoms, and they're very hard to distinguish. If you don't feel a physical pain, then you don't really tend to look for a physical source, right?
Well, they've done some studies. For instance, weight gain is a very well documented premenstrual phenomenon.
Right.
However, in the studies that were performed where they gave diuretics to women who had weight gain, the weight gain went away, but the women still had their premenstrual tension.
Right.
The only study that I read where perhaps premenstrual tension was affected was one where they gave a tranquilizer to a group of women. This was done several years ago. I'm not advocating tranquilizers for women to control this, but there's a tremendous variability among women. The same women who get the swelling and the edema and the perhaps physical discomfort don't necessarily get the psychological discomfort.
Yeah, but Cynthia, for instance, if a woman gets relief during this time from tranquilizers, why shouldn't she take tranquilizers? You know, I mean, for instance, I think a lot of times women will talk to doctors and tell them that they have, you know, they have certain kinds of feelings at this particular time of the month. And very often it'll be poo-pooed and the doctor will say, well, when you'll get pregnant, they'll go away, or when you get married, they'll go away, or when this and that'll happen, or stop worrying, or with time they'll go away, but maybe they don't go away. And even if eventually they change, for instance, if a person can find some kind of relief from these kinds of discomfort, why shouldn't they have that?
Yes, well, I think it would still be temporary. It's nice to
Well,
at least...
I mean, the thing is, though, even a temporary relief, if, I mean, for instance, if a woman gets used to the idea that every month she's going to feel really rotten, I mean, 1 month tends to lead to feeling rotten the next month, whereas sometimes if you feel that you know a way of getting relief, in the ensuing time, it could conceivably relieve a lot of your burdens because you might not feel so scared of something.
What about the
And then-
physician, though, who says to the patient, you're not accepting your femininity?
Well, I would think that he's not accepting their femininity, or really, I don't think that he's even accepting the authenticity of their complaint.
What, do you feel that this plays a role in premenstrual tension at all?
I think that it could with some people. I don't, you know, I'm not going to say everyone, but I would think that it could. For instance, I think that if an authority figure, which many physicians are, if an authority figure says to you, well, you shouldn't feel like that, you know, which means you're really not being a very adequate person if you feel like that. Well, first of all, you've not only confessed how badly you feel to someone who, you know, so hopefully would give you some kind of comfort, either in advice or medication or whatever, and he says, oh, poo-poo, or she says, even, oh, poo-poo, then you get so that you're even ashamed to tell anyone else about it, too. So that you kind of suffer alone, and then the suffering alone, if you now feel you're an inadequate person because here you are suffering and not accepting your femininity and not accepting your identity, then it seems to me that it simply adds to the burdens you're already carrying.
Do you find this is a problem with the young girls that you treat?
I think that if you give them an outlet to talk and discuss the problem, they do much better and require very few medications. There are some young teenagers, or quite a few, that are really scared or terrified. They're afraid that perhaps they'll get very sick or get epilepsy or some serious disease at the time of their period. They're afraid if they're not regular. This has been a very big problem. People run if they're not on the dot, and nobody really is regular. That's a myth. And they're very frightened. I generally, when I see a frightened girl in the clinic, give a mild analgesic, but then have her come back several times and talk. And that's a very minimal kind of psychotherapy. It's just having someone else, perhaps other than your mother or somebody, to talk to.
Do you have any feelings about the medication that is available?
Yeah, well, it used to be much stronger. What was on the market used to be much stronger. There were many medications that had amphetamines in them and tranquilizers in them, and most of these have been taken off the market. Generally, there's only analgesics right now, and I don't think they work at all. I think pretty much it's a placebo effect, and you tell someone during their period, kids could really have cramps anyway, and maybe they need an exam, maybe there's something wrong, maybe they have endometriosis.
Well, is there
or some
anything
condition.
wrong with cramps? I mean,
almost everybody has some kind of feeling or pelvic discomfort, I think, the first day or two of their period.
what are some of the symptoms that are very common and acceptable?
Well, premenstrually, acne and swelling. And the swelling is often breast tenderness, swelling of your belly or of your feet. And then irritability and depression are reported among many women. With the period itself, this cramp, aches, joint pains, headache, and even dizziness has been reported fairly regularly when you take a survey of.
Is it common for women to go to a physician for these symptoms, do you think?
Depends.
Oh, well, some women will go to physicians and some women will talk about it in psychotherapy, although I think generally in this area, I think most women will probably talk to physicians sooner than they will talk to psychotherapists.
You're
And
implying, though, in a way
yeah.
that they should talk to psychotherapists.
Well, I think they should talk to anyone who will accept them and and listen to their complaints without judging them. To listen to the complaint seriously and not tell them, oh, it's not as bad as you think, because who can tell someone that their pains are not as bad as they think?
How much do you feel we're affected culturally?
Well, I personally think that we're affected culturally to a great extent, even in the way we take in the acceptance of our pains. That is, I think that basically we're a culture which is founded on the Puritan ethic, that you're supposed to kind of barrel through everything without too many complaints, and that you're supposed to raise yourself by your own bootstraps, and you're supposed to overcome things by willpower, and that any kind of pains are a sign of weakness, and so forth and so forth. And to that extent, I think that a lot of times something that should be taken seriously, or, if it doesn't have to be the end of the world to be taken seriously, I think that probably the tensions that are added to feelings of, that if someone feels personally inadequate, psychologically inadequate, I think that could even add to the tensions they already feel, and that what they feel about their own value as females will also have something to do with the kind of feelings that they might have premenstrually, postmenstrually, even premenopause, postmenopause.
You were going to say something,
Yes,
Cynthia.
sexual inadequacy is also very important, and marital problems are also, which go along with perhaps sexual inadequacies are very important things to take into account. And those women that have problems and that score have many more symptoms, both premenstrually and often even with their period. They tend to get much more pain and be much more upset and go much more hysterical.
Right. And also, I think that for a lot of women, the menstruation is very much associated with their feelings about pregnancy, too. That is, their fears of pregnancy are related to the menstrual period, and it affects their feelings about sexual relations with their partners, and that has a part to play, and their feelings about menstruation also is affected by what they feel is their value as women in the world generally. That is, some women, for instance, feel that the only value that they truly have is to bear babies. And so I think in that regard, if that's what the woman feels is the most important thing that she has to contribute in her life, then how she feels before and during and after her period has a big part to play in a lot of her feelings about herself and that particular time in her life.
Is there a healthy attitude that you could describe?
Well, I don't even know if I like the word healthy, because...
well, I'm very anxious that we not, label premenstrual tension as a psychological problem. And
well, I really don't feel that we should label it a psychological problem only, because I think that it has a big component in physiology and glands and hormones and so forth, which I know affects one's frame of mind, but it's a physiological basis to your frame of mind, and I think that the best attitude about everything is self-acceptance, so that if you can accept how you are, if you just say to yourself, well, I know that before my period this is the way I am. I tend to have cramps, or I tend to feel headachy, and that's how I am. It doesn't make me an inadequate person. it just makes, that's how I am, and I'm going to take care of myself to the best of my ability, and make myself as comfortable as I can, and not tear myself down because I happen to have headaches, or because I happen to have cramps, or because I happen to feel a little depressed at a particular time in my life.
Well, I think it's important, if we're going to do that, to get to the children when they're young, and just 8 or 9 years old, learning about their period and about how you grow up, and about life a little bit better. And that way, perhaps as teenagers and adults, we won't have so much problems accepting this fact. Once you are much older, it's very hard. These feelings are so automatic, and they come. It's very difficult to overcome them. Even in intensive treatment, or talking about it, or even trying to accept it. They're still there upon you, whether you try to think about them or not. But maybe the new generation of kids have a chance if we get at them sooner.
It's difficult, but it's not impossible, really. That's the important thing. And I had an interesting conversation with my daughter, who's now 11. I had this conversation with her about a year ago. And she wanted to know something about menstruation, and she said to me, how do you feel when you menstruate? And so I tried to, she said, oh no, she said to me, what does it feel like when you menstruate? And I tried to explain to her what it felt like to me. And she said, do you like it? So I said to her, yeah, as a matter of fact, I do. I said, it really feels nice. Because I said, she said, well, what's so nice about it? So I said, well, what's really nice about it is the fact that I get the feeling that at least my body feels to me like it's doing what it's supposed to do. It makes me feel very natural. And that seemed to be a very satisfying answer to her.
We have about 1 minute left. I just want to throw something at you. Does all this mean that a woman couldn't be president of the United States?
No.
Absolutely not. They've shown no correlation with intelligence or in being able to handle a superior job. With your
I'd
period.
also like to add one comment to that, and that is that I think that that this idea is often used, that women don't function so well every single month because of their menstruation, and yet, I mean, men don't function so terrific every single day of the month either, and I don't know what's so wrong with accepting just biological, rhythmical changes.
Okay, on that note, thank you very much. We're out of time. Thank you for watching. See you next week.